Sexual medicine is my specialty now, and how I got into sexual medicine is by getting people's hormone levels balanced, and then they realize that they do have desire to have sex, and now what do we do with it? So I originally started out by teaching some classes on sexual awareness and teaching people where are your parts and how do your parts work and how do those things go for men and women, and got more involved into the sexual medicine world and just really liked it a lot. So I now see patients that come in with questions about how do I get my libido up. My husband now his testosterone's good, or he now has realized he can take Viagra to help his erections and he wants to have sex more. How do I make my interest in sex better? It was better years ago when we were younger. Now we have kids and a job and a house to keep and bills to pay, and how do I get that better? Also, I have women that come and they're having sex and they've had years of not really feel like they're having satisfactory sex, being aroused during sexual activity or having an orgasm. So I do see women for all those things. There's also issues of pain with sex that because of the invention of Viagras, older women, postmenopausal women who are not on hormones are having vaginal dryness, and they're just not able to have sex the way their partner would like to, or the way they did when they met 30 years ago, those kind of things. So patients come to me for those complaints, and in that same thing, we do look at their hormone levels. And the only treatment that's really out there right now for women is testosterone replacement. Unfortunately, it is not FDA approved, so we are doing testosterone replacement through the compounding pharmacy, which is considered off-label. Most women do really well on it. The unfortunate thing on testosterone for women is there are some side effects that they have to deal with, and each woman has to make that decision for herself. The side effects are not bad. There are side effects that are things like a few acne spots or growing a little hair in places they don't want to, and or aggressiveness. However, the world of the aggressiveness is really small, but those are the little side effects that they have. For most women, it does really well for them. The other side, good part of testosterone replacement on men and women, even if it is, even with the added benefit of treating their libido, is that it helps with a little bit of, helps making bone and some of their other health issues, so it kind of goes along that way. So for women, if they do have a low testosterone level and we would like to help them with that, I have them use either a cream or a lozenge. The lozenge is usually put under the tongue in the mornings because testosterone does increase energy, so it's actually a good thing to do in the morning. But the thing that I probably like the most is using a cream that they can actually put on inner thigh or actually on the female genitalia. The nice thing about that cream is it actually helps blood flow come to the female genitalia area, so it helps with arousal and then helps with orgasm. So a lot of women like that option. A lot of times I have them put it on every morning. They may not need to do it prior to sexual activity, but do a lot of times allow them to do it prior to sexual activity. So in looking at a sexual dysfunction issue for women and men is that not just getting their hormones balanced, their testosterone can look awesome on paper if you get their levels up. However, there's still a lot of things that have to be looked at as well in that. You have to look at, you know, how is their mental status doing? How are they psychologically? Are they having some depression issues? Are they having some anxiety issues? You know, women's brains on the women's side, they just don't shut it off. So a lot of things are going on there. The other thing is getting the woman to feel good about herself and be happy that, well, I've gained 20 pounds since I and my partner met 30 years ago or 20 years ago, but just feeling good about yourself where you are. And then the other thing that gets involved is past histories. how they were raised. Everybody has how they were raised with their parents or their grandparents, and what are the beliefs in sexual dysfunction, in the sexual world, and what are your actual thoughts about having sex and those kind of things, and how far you go. Also for women, we have kids and we have a job and we're cleaning house and we're doing laundry and we're buying groceries and we're doing all these other things that get in the middle of sex. Men can turn it off a little easier, and women can't turn it off. So those are just some of the things. And when you come to see me, we spend an hour on the first visit. We do the hormone levels, but we also have a long discussion about all those other options that are happening out there.